All. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. So once again, we have another rock star today. You would actually see his work and you would agree with me that he is a rock star. I believe that if his work was not present as an underpinning for FLCCC, for me, for Dr. Tess Laurie, for other doctors, they would not have been able to make the case as compelling as it is now. And that is, we have with us Juan Chamie. He is a senior data analyst. He is a software engineer. He is an entrepreneur. And I'm going to very quickly read his bio to you, show his bio to you, and then we'll start talking about Ivermectin data in India and in Mexico with Juan. And I think that is a huge deal. For example, we all listen about India's news all the time. Goa, this happened, Maharashtra, this happened, Kerala, this happened, and so on. Some people say Ivermectin is used, some people say it is not used, some people say Ivermectin is not effective, some say it is effective. So all that, those myths can be demystified with Juan's help today because he has the data and he can discuss the data with us. So please be patient. So this is Drbeen.com. Here is Juan's page on FLCCC. So here, epidemiological analysis on COVID-19 and Ivermectin. Juan Chamie is a senior data analyst who has been tirelessly researching and spreading the word of Ivermectin. So you can read a bunch of this, but Juan started with data from Peru, whichever way it is called, a beautiful country. And from there, Juan then now is analyzing data from Mexico and India as well. He lives in Cambridge, Massachusetts, my favorite place. Originally, when I came to US, I came to Massachusetts and I lived there for 13 years. I love that place. And then I came to California. So something that I connect with Juan for that. So Juan, welcome. Thank you very much for joining us and adding ambience to our neighborhood.
Thank you, Dr. Mobeen. Thank you for having me here. I'm honored to be here with you. Yeah, I've been just looking at the data and trying to understand better what is happening in the world.
So tell me this, before we look at the data with you, you are the one who is looking at the data, who's processing it, putting it in graphs. So when you look at those graphs, does this happen in your head that, hey man, all the evidence is right here, why do you not understand? For WHOs or FDAs, does this happen in your head?
It's happening again and again. I was so excited in June last year when I saw this data in Peru. I said, it's impossible that this is a random result. This is the solution. If someone wants to solve this problem, they need to look at Peru and the pandemic is over, because it's extremely evident. And that happened again and again. In one state, they started the distribution and then drops in deaths. Then another state, like 1 week after the distribution. So we said, there is, and then I started writing the paper about Peru and trying to find another explanation, because I'm very skeptical. So I was trying to say, okay, maybe it's because of the dengue. Maybe it's because of they have herd immunity already. Maybe it's because they are social distancing. But every honest explanation was there wasn't explanation. There was places without dengue with the same behavior. There was places with just a few amount of deaths and then reduction. So it wasn't herd immunity. There were places in the mountains. There were places in the sea level. There was no explanation. No. So the only explanation was distribution of Ivermectin.
Very interesting. So let me ask you one more question before we go to India and Mexico. Now that you are processing the data from India, from Mexico, what happens in your head once again, looking at this data? Do you come to this conclusion that, hey man, everything is right here, data is showing it? Or do you develop some doubts as well and say, maybe it is not working? What is your opinion?
I have doubts. So, for example, in India, I can say probably in some places the lockdown is working, but then I compare with another place with the same lockdown and without the intervention, and there is no reduction in cases or deaths. So I always try to find like an alternative explanation.
So you start
There
from a
isn't.
place of doubt.
Yeah, I'm extremely skeptical. I don't believe like say, oh, this is the solution. And I really look at the data. The thing is, after more than a year looking at the results, it's absolutely clear that this is the explanation. And something that I have learned from this process is that the Ivermectin works, and it's so easy to explain or to find the reasons in the. So when something happened, sorry, if someone said, this is not the reason because X or Y, or he said, yes, because this is the reason, because Ivermectin is the explanation, these other explanations always are easy to debunk. Because there is the reason is Ivermectin. It's not something that we are making up the story.
Got it. So cool beans. This is the basic summary of the discussion that I wanted to understand if Ivermectin from a data analyst's point of view, who's looking at the data, are they actually impressed with this or not? So looks like Juan is impressed, as you can clearly hear. So let's go over Juan's data and let's discuss it together. So again, this is not a presentation to regurgitate data to you. This is more of a discussion together, including you, to say, hey, let's ponder, let's peer into that data together to see what is it that we're seeing. So Juan, you ready?
Yes, let's start.
Okay. So I'm gonna share your presentation. This is Juan's presentation, and we are going to go over this. So Juan, please guide me whenever you want me to move to the next one or previous one, and I'll do that. So are you able to see it?
No.
Okay, so because I did not share it,
Okay.
so my apologies. So can you see it now?
Yes. So yeah, evidence in India and Mexico. Just you can skip it. And the next one. So this is the first part is to understand if in India the outbreak is how the press is showing everyone. That is everyone is dying. This is the worst thing ever in India, and it's actually is bad. Is the number of cases are like 4 times more than in the previous wave. But if you compare with other places, it's not that bad. If you compare with South America, the peak in South America was double the peak in India, or in North America, same, or in the European Union. So it's bad, but it's not that bad. So we can see the next one. And
is this one or this one?
Yeah, this one. Yeah. So case fatality ratio is the percentage of people with COVID or detected with COVID that died. And if you compare the same group of like regions, India against North America, European Union, and South America, India is better. Is below 2%, and all of the rest are much more than that. So is India mismanaging the pandemic? I think it's the opposite.
So then tell me this, why is there so much concern that somehow India is in a bad shape when here we are seeing with data that there are other regions that have actually been hit more dramatically?
It's because of the numbers. If you look at if you compare India with the United States, India is 4 times bigger in population than the United States. If you compare with Brazil, India is 7 times bigger than Brazil. So if you compare the numbers, you say, India is having, for example, right now it's like 3,000 deaths. But Brazil is having the same 3,000 with 7 times more population, 7 times less population. but the actual value is the like the alarming for the media. Not
Got it. Got it. So what you're saying is that the absolute numbers are alarming, which of course every single death or misery is a problem. However, the percentages, if you see, then India is still doing much better than countries like Brazil.
And if you look at the in a normal day in India, 25,000 people died in a normal day without pandemic. 25,000, and now the peak was 4. So it wasn't. It's bad, but it's not as bad as the media is trying to present.
I understand.
You can go to the next. So the question about India is the data trustworthy? Because now the last wave of news is India has 5 times more deaths. This is what the New York Times is saying now. So I don't think they are faking the numbers. First, they have data available like in real time. They have data available per district. If you want to fake data, you need to have a extremely strong machine to change the values. So they are testing. The testing is showing reasonable numbers. The positivity rate is not like 50%. Is very manageable. They have hospital capacity information available in most big cities. So we can. The information is there. So they're not faking the data. And there is some things that are happening now is that I think they have elections probably next year, and the party in the opposition is trying to sell the idea that the prime minister has been managing the pandemic. So they said, there's the deaths in Uttar Pradesh are more than that, and they try to show like hospitals with a lot of like packed hospitals without beds. But imagine in a country with 1.4 billion people, you always have a hospital with 100% capacity. And there was a huge amount of the outbreak was really bad in some places like Delhi, but not anymore. And another thing that they were saying again and again, the press was about these dead bodies in the Ganges River. And I say, okay, this is first thing is they were talking about 30 dead bodies in a region with 200 million people. This is not first. And the second is I was just researching, and in the Indian tradition, they put the bodies in the river when they die, and they burn the bodies, and the river just move the bodies. So it's absolutely normal. So it's not like they were just throwing the bodies in the river because there is not enough space in the normal places. It's a tradition, but
makes sense.
Yeah. And this is another one to try to explain that why I think India is not undercounting the deaths. Is in these two charts we can see two in the one in the left, Peru and Mexico are the places with the high amount of excess deaths or unreported excess deaths, and is absolutely related with the testing capacity. If you probably it's difficult to explain the concept, but if you when you are testing, every other person have a positive test is because there is a lot of people that you're not testing with the virus. And this is what was happening in Mexico. You can see was 50% positivity rate, 40% positivity rate. And in Peru was less, but also was big, but 30%, 20%. In India, it's not the same situation. And if you look at in the other one, the places with less excess deaths or unreported excess deaths, they have a similar testing positivity rate in testing than India. So there is no data about excess deaths in India, but based on this information, I can assume that the excess deaths in India are probably similar to the United States, probably 10% more, no more than 20% more, not 5 times or 3 times that someone like tried to say.
Got it. And while you are discussing it, just give me one quick second. I want to make sure that I can close these windows. They are churning my computer. So 1 second, please. This and this one.
Yeah.
And the other question that I have is that with this data that you have discussed so far, it seems like India, with a bigger population, and maybe the resources may be not as sophisticated as US, they're still doing better. Is that correct?
Yeah, they are doing better, and I'm really amazed of like how after this huge amount of cases they managed like to reduce cases and deaths and everything. It's yeah, I feel that they really care, like the politicians or the people in charge, they really care about people.
Got it.
Yeah. So is in this part is how the second outbreak started in India. This is I read the news and say it's because of they have some political parties and they have some religion festivals, and that was the reason of the outbreak. And I say, okay, let's look at the data and see if this is the actual reason, and it's not. The big festival was in Uttar Pradesh at the beginning of the year, and there is not cases in Uttar Pradesh at the beginning of the year. Everything you can see the maps. There is 1 week by week. We can see that the state that they start like increasing cases, so it's getting more greener, is Maharashtra. Is the state where cases started and growing and growing and growing and growing, and then from there it moves to the rest of the country. There was another outbreak from the north, probably coming from Pakistan, but the biggest one is Maharashtra. The data is clear. It's not. There is another like theory that some people say, it's because the vaccines, when they started vaccinations, the cases increased. I think India is an example that this is not the case.
And Juan, tell me this. My apologies for the interruption. What is your source of data? So can I say that this data that you're presenting, it is reliable data? Are you just making up the numbers from some new? What is your source of data and reliability?
The sources. My sources are always the primary source, the governments, the big hub repositories with the main source and the more granular level. So I have data of cases, deaths, and even vaccinations per district in India. So I can follow like these patterns every day.
Got it.
Yeah, and anyone can. I always use the source in the charts, and anyone can go to the source and look at
makes sense.
Is 100% the same information. I don't change anything.
Got it. Thank you. Yeah. Don't be offended. I wanted to make sure that they ask you that.
And in the next, we can see in the state of Maharashtra that the outbreak started in one specific spot. Actually, 2. I have now this is the area of Nagpur, and the second is not in this chart, but the second is Pune. Is in the south of Delhi. Okay. And in both places, they started increasing cases and deaths. Not other place in the country. So we can see in the next one in the next. We can see the whole country. The last 2 weeks of February, or no, the last of February, the first of March, and you can see that no other place in the whole country had this amount of cases. Only this spot in the state of Maharashtra. So everything started from one small spot. One, it's not like there's outbreaks everywhere. No, it's only one spot, and then from, I think we can go to the next one. From this spot, this is what happened in the north of the country, because I have the theory that Delhi received the cases from Pakistan. They moved from Pakistan to the state in the border, this Punjab, and then they moved to Haryana and finally to Delhi. And there was this explosion of cases in Delhi.
Got it. By the way, just something fun. I am from Punjab as well. So, okay. Yes, please, back to you.
Yeah. Now we can go to the next. And this is what happened. So first, this outbreak started in Maharashtra. The cases and deaths and all this pandemic was growing in the state, and finally arrived to Mumbai. And Mumbai is a huge city, and with probably 50% of the population are migrant workers. So they are there only to work. So they just leave the country. They leave the city when they think that there's gonna be a lockdown. Lockdown means not work. So they just go back to their cities. And we can see here, this is actual picture from train that people live in Mumbai. It's not, no one was social distancing so imagine trains with 1,000 people in a 24-hour trip from Mumbai to Lucknow. If there is only one person infected in this train, at the end of the trip, everyone has the virus.
Got it.
So, and in this way, the virus is spread in India. So we can see in the next one, the main destination of these migrant workers is Lucknow in Uttar Pradesh. And we can see this is the state of Uttar Pradesh, and we can see the red dot, the red arrow is pointing to the capital city, the Lucknow, and we can see that the cases started growing from this specific spot, like right in the middle of the state, and from there we're growing to the rest of the state. Why? Because Lucknow is the main destination of the trains from Mumbai. So all these people arrive to Lucknow. Imagine like 1 million people with COVID arriving to New York. It's a disaster. And this is what happened. We can just go to the next. So how they control the outbreak? First, the outbreak started in February in the state of Maharashtra, and at the end of in April, it spread for the rest of the country. And before the new national protocol, what the media was selling was, okay, the solution is remdesivir. Was again and again in the press, remdesivir, and we can see in Google searches that remdesivir in the one in the right, in the red line, which is searches about remdesivir, are way more than Ivermectin, and people were crazy about remdesivir. It's not, remdesivir in India is not expensive as in the US, but it still is much more expensive than Ivermectin. So in the first part of before the new protocol, people was just trying to get remdesivir, and cases were growing. So we can look at the next one. This is what is before the new protocol. Look at this is the cases in India.
So this is the while trying to work with remdesivir or other things, then ivermectin,
Yep.
and the cases are just going up.
So this is the new protocol was published the 22nd of April, and this is the cases until the 22nd of April, growing like
Crazy.
Like crazy.
Exponential growth.
Yeah.
Got it.
So we can look at the next one, and this is after they started the protocol, the 22nd. This is what happened after. You can see the growth decrease, and now it's going down, and it's going down very fast. And if you look at this one is, this is a comparison between India and Israel. Cases per million people. So it's again showing that it's not that bad. It's bad because it's huge. But if you compare with Israel started vaccination and an extreme lockdown, and they reduced the cases, and in 4 months they have a 2 months grow and then 2 months decrease. India has 1 month grow, and it's gonna probably in 1 month it's gonna be over.
Very interesting.
Yeah,
very interesting.
We can look the next one. This is the same with this is deaths. It's
Got it.
Yeah, there. So state-wise response, there are some amazing cases like Uttar Pradesh. It's just amazing. It's the example of United States receiving 1 million people with infection and increasing like 6 times from the highest peak of cases, and in 1 month controlling everything in a 230 million people. It's unbelievable. Yeah, they started. It's impressive. They started using Ivermectin in August last year, and they learned how to use it, and they have I think they had the perfect way to control the pandemic.
Sorry, please.
No, they have groups of people going to house by house and detecting people with COVID and treating everyone, not only the one with COVID, everyone.
The whole family.
The whole family, even probably the whole neighborhood. I think they have like a 25 meters around the one with infection, and they were treating this group of people. That was in September. Probably is the same now.
And the treatment meant ivermectin?
Yeah.
Wow.
Yeah.
So can I reflect back what you just told us for Uttar Pradesh, that here is the exponential growth in numbers, and it seems like it is out of control. And am I correct to think that here is when at the top is where near that time is when they started using ivermectin, and then within a few weeks they have declined so fast back? Is that a correct understanding of this?
Yeah, I don't think I think they were using Ivermectin since the beginning. This grow is all these people arriving to the state with COVID. They have all these people arriving from Mumbai, and also a lot of people from Delhi.
Got it. So
it's just in the next. Yeah, it's
got it. So you're saying is that they were using ivermectin before for the residents of the state, and then there are people who are coming from outside who were not using it, or who were infected, and they even managed to control that part as well.
Yeah, it's just amazing. Yeah, they have the positivity rate was 20% in the when everything started, and now it's less than 1%.
Wow,
it's just and Delhi is another really good example. They were rejecting the Ivermectin in the past, and finally they recognized Ivermectin in September, at the end of April, and they started treating the people with Ivermectin, and it's also amazing. It's 10 times smaller than Uttar Pradesh, but it's a big city with very high density, and they control the pandemic. They have a strict lockdown too, that is playing a role. But if you think about India, there is the average amount of the households are like almost 5 people per house. So you need it's very difficult to control, to make a lockdown and control that people have social distancing and no one is going to infect the other one just because of the lockdown. So there is a strict lockdown, but I think the main reason of this decline is the treatment.
And I would continue to sensitize the viewers here. If you see here, this is May dues. I had done this discussion as well, April 2021. And here, if you see tablet ivermectin 200 microgram per kilogram once a day for 3 days, avoid in pregnant and lactating women, or hydroxychloroquine and budesonide. So this is the approach they took. And there is a thing that even if not everyone got the ivermectin, at least when authorities come out and they say, you know what, it is fine to use ivermectin, that enables, that empowers people and doctors to use it. When authorities come out and say it is not allowed, then everybody who's using it and prescribing it always have that little feeling that, am I going to be in trouble? Yeah. So this is the difference of the medical leadership that I have been saying for a year. So sorry for the quick interruption.
I actually have a really good example of this. There is something that happened in Colombia, in my country, at the end of January. They for the first time in the whole pandemic, they interview someone pro Ivermectin, Dr. Héctor Carvalho. They have this interview in the main radio channel in Colombia, and he was talking about Ivermectin, and he was talking about how safe is Ivermectin, how the treatment and everything. And right after the interview, cases and deaths drop in the whole country, like a miracle.
Wow!
Because people can go on to the pharmacy, not here in the US, but in India and in Colombia and in Mexico. People can go to the pharmacy and buy Ivermectin. So if they know that this treatment works, they are going to do it.
Got it.
This is a very sad story in India. It's the state of Tamil Nadu. I think they have a new ruler of the state, and he said, we are going to follow WHO, so no Ivermectin. And in the rest of the country, cases and deaths are dropping, but not in his state. So,
got it. And just a quick interruption, my apologies. I saw this message that somebody got blocked. Yes, so there was someone who was just continuously spamming with some comments. I do not know these were good comments or bad, but they were just continuously spamming, and it was messing up the situation here. So I blocked them. I'm sorry if they didn't deserve it, but just spamming with so many comments while we are trying to have a discussion is not best. Sorry, Juan, back to you.
No problem. So this is if we need a control test, a control group, we have the control group. We have an entire country of 1.4 billion people using Ivermectin, and we have a state with, I think it's 70 million not using it.
And Tamil Nadu is still not using it?
No.
And Tamil Nadu has become the primary source of more than 12% of the total cases are now in Tamil Nadu.
Yep.
And they're not looking at other states to say they're doing something that may be useful, so we should try it as well.
It's sad. I saw some, I think in Chennai, the capital, there are like 15 districts or regions. In one of the regions, they have the protocol with Ivermectin. This is the only thing I saw.
And I saw a tweet. I'm so sorry. I become excited and I start speaking as well. My apologies. I saw a tweet where somebody had tweeted from India that Tamil Nadu's healthcare, whoever person was there, they said, I'm very proud that I'm not using Ivermectin because maybe they think WHO is saying otherwise. So what is the situation? So Tamil Nadu, even till today, they just continue to go up?
Yes. they're growing and growing and growing and growing. There is a small decrease in cases in Chennai. I think it's because of they have a very strong lockdown right now, like probably for the last week. So lockdowns work.
So there'll be some improvement.
Yeah. So this is another state. This is the north of Uttar Pradesh, Uttar, and they started Ivermectin as prophylaxis. And in the moment they announced the prophylaxis, cases are dropping very fast. As we can see, positivity ratio from 22% to 6% in 2 weeks.
So this is the when they started using Ivermectin, my thought was that for a few weeks we would not see much results, but within 2 weeks, within 10 days, those communities that start using Ivermectin, they show a drop, which is unbelievable drop.
Yeah, the thing is, normally what happened is that the government make an announcement. So probably what happened in Goa. The government said, okay, we are going to start using Ivermectin next week. But if you're sick, you go to a pharmacy and buy Ivermectin, because you don't wait. I'm going to wait 1 week until the government, I have Ivermectin for free. No, if you're sick, you just use the treatment.
And this is true for many of the countries in that area. I know about Pakistan and India, that you can just go to a pharmacy and say, hey, I want this drug, and you can get it.
Yeah. This is, some people say, Tamil Nadu, the reason is because they have a low rate of vaccinations. So we can see here that it's low, but Uttar Pradesh is lower, or Bihar is lower in vaccination. And these two states have the less amount of cases. So it's not the reason that Tamil Nadu has a few vaccinations, because states with less vaccinations have less cases.
Are doing better. And generally, vaccination, until it reaches a point of 60-70%, it does not create an effect of dropping the cases fast. Just study Israel's case, 30, 40, 50, the cases were not becoming slow. And then soon after that, they started declining. Mm-hmm. So India's total vaccination with 1 dose is about 10-11%.
Yeah.
And with 2 doses is about 3%. That is a drop in the bucket.
Yeah, it's not vaccination. Is not the explanation. It's not explanation. And this is probably the last one for India, is trying to explain the cases, the dropping cases by mobility. So we can see that Tamil Nadu have the same mobility than Uttar Pradesh in the bottom, and cases are dropping in Uttar Pradesh and not in Tamil Nadu. And if we look at the Maharashtra, the reduction in mobility is higher, and the cases are a lot.
So for me to try to understand this, the chart above, what is this showing?
It's cases related to population.
100,000. Yeah. And the chart below is showing mobility of the people moving in and out of the state?
Yes, it's Google mobility data. So it's people going to work, or so actually it's moving less. Moving less to work, moving less to parks. And
so if I look at Tamil Nadu, for example, it shows that their mobility is less. That is probably the lockdown, but that's still more.
Yeah. This is the new lockdown, and that's the reason of the small reduction in cases in the last couple of days.
Got it. And for example, Uttar Pradesh here shows more mobility than Tamil Nadu, but less cases than Tamil Nadu.
Yeah.
Very interesting. Thank you very much for this. Great results here. And this is what I meant, that when we look at the data, we can think for ourselves if something is working or not. Let's move to Mexico.
Mexico. This is how the outbreak started. Basically, cases arrived from the United States in the north. People flying to Mexico City. They're right in the middle of the in the country, and the other place is Cancun, like a tropical destination. So that was the outbreak in Mexico. So it was from different places and was growing slowly. So there is something interesting they had a kind of first wave, and they have a reduction in cases in August, and the reduction in cases is coincidentally after increased interest in ivermectin.
Okay, so let me, sorry, I'm interrupting you here. My apologies. I want to understand these charts. So this chart here is daily new confirmed cases per million.
Yep.
And when did they start ivermectin?
They were denying ivermectin all the time, but what happened was the ivermectin was in the news because Peru was using ivermectin, because Bolivia was using ivermectin. So what's all in Central America, the people were like governments were using ivermectin. So what's in the news in Mexico? So people in Mexico increased their interest for ivermectin. So, and right after there was a drop in cases.
Okay, so where do I see that on the charts? Or do I go to the next slide?
Yeah. No, it's this one. And if you look at the mobility, the one in the right, there wasn't. The mobility was even increasing. So the explanation of this drop is, I would say, is more related with ivermectin than to mobility.
Got it. So here you're showing that people were mobile as they were, but cases were dropping and the ivermectin searches were going up.
Yeah.
Got it.
And then there is a second search that was the worst. This time was only from the United States. This is the border from Texas, and was like the colors show that there are more cases, is more red everywhere, and it was really bad. It was really bad from September to the end of January. It was a really, really, really bad situation in Mexico, and especially in Mexico City. So here we can see cases per 100,000 people, and the line in the highest one is Mexico City.
And why did it increase? So look at September, October, November, it shows lower numbers, and then near December, it just starts going up.
Yeah, it's like why? They were growing slowly in different states, and then just was explosion in Mexico City. It's a huge city, and people also live very close to each other, and the mobility was higher. So
they were not very careful, and it was spreading. And here we are seeing the spread.
Yeah. So, but where was the breaking point? In January 22nd, the health officials in Mexico City announced that they were using ivermectin for treating COVID patients since the end of the year with very good results.
Got it.
And that they plan to
just a quick
keep using ivermectin.
My apologies. So if I am a health official and I'm seeing this level of the change, I will also say do whatever but protect people. So here you're saying on January 22nd, they said we're going to start using ivermectin.
No, in January, they have a meeting in December, and in the meeting they decided to use ivermectin. But they never say anything to the media or to the public. They in December they have a meeting and they said, I wasn't there, but they decided to start using ivermectin. So they, at the end of December in Mexico City, everyone who tested positive received the treatment with ivermectin, and they started taking register of all these people to control in a kind of a clinical trial. So they started the distribution at the end of December, and they were counting all the people, and they were measuring if they were going to the hospital or not. And the 22nd of January, because they said we started this study in December, the results are very good. Now we can share the information with everyone. So in January 22nd, in a press conference, said we are using ivermectin, and we are going to keep using ivermectin. And also the interest in people, of course, increased because
So
of the press
give me
conference.
1 second. I'm going to block one more person and then we'll come back. Okay, so we have one more person blocked. Congratulations. Let's continue. Okay.
You can go to the next. So this is what happened after the intervention. If you look at the cases, there is they were dropping. This is 16 weeks consecutive drop. Right now they have 19 weeks in consecutive drops, reduction in cases in Mexico. Because at the end of January, they started the program in the rest of the country.
Wow.
Not only in Mexico City.
This is real, that Mexico, we saw the result of what was happening there. And then they said, hey, we started using ivermectin. And here we are seeing a drop, which is unbelievable.
Yeah.
This is like everybody just sat at home and not doing anything anymore. And the case is going down.
Yeah.
But this is when ivermectin.
Mobility never changed it was. And I think the next one is deaths. It's the same thing. They had a huge amount of deaths in Mexico City, a huge amount of excess deaths, and now it's under control.
Wow.
I think they have this program, and they were giving ivermectin to people tested positive, and they didn't say a lot about ivermectin in the press. So they just said, okay, they made the announcement in December, in January, at the end of January, but nothing else. So I think that if they were more active sharing the information, probably the drop will be more faster, like in India. Because they were just treating people, but not saying a lot about the treatment.
And I think this is, once again, I have been saying this for the whole last year, and I would say it once again. Medical leadership, actually leadership in any area, is very, very important. It may be 1 or 2 persons, but their inclination is going to be sensed and used by the whole community of the followers. Medical leaderships have to do the right decisions. And here you are seeing the difference in decision making. Ivermectin is available everywhere. It's the decision making that is making the difference. So thank you very much, Juan. Should I go to the next one?
Yes. Yeah, this is excess deaths. Excess deaths just went to, I think this is the entire country, almost twice the amount of deaths that a normal time, and now nothing.
Wow. This is the drop?
This is the drop in the actual amount of excess deaths.
So these were the excess deaths. And then what is this A and O?
This is the year. This is the change of the year. This is for 2020 to 2021.
So this is 2021.
So this is the highest, is the last week of January, when they make this announcement about ivermectin.
Which emboldened and empowered others to use ivermectin more freely as well. Yeah. And here we go.
But still, she's the mayor of Mexico City. She's the one leading this program with the Mexican Institute of Health. But the Minister of Health is still not saying anything about ivermectin. What they are saying is, no, they are not mentioning anything, that this is the reason of the drop. And I think yesterday, it was kind of funny. There was an article about the drop in deaths in Mexico. And the explanation was, one of the explanations was people going to the United States to take the vaccine. It's like Mexico has 165 million people, and probably 10 million have a visa to go to the United States. And probably, I don't know, probably 20,000 or less have received the vaccine in these trips. So saying that the reason of the drop in deaths is people going to the United States to take the vaccine is just
not correct.
No.
And it is so weird that if ivermectin is working, people come in and say, this was vaccine. And then if somewhere there is the infection that is spreading, people come in and say, this was vaccine causing variants. It is just weird for me. Ivermectin has its own benefit. It is right in front of us. Vaccines have their own benefit. If you want to see how vaccines work, look at Israel, look at UK, look at now US. If you want to see how ivermectin works, look at India, look at Mexico, look at many other countries that used it successfully. And a combination of these two is even more powerful. So, sorry, back to you. I just can't stop myself sometimes from
No, it's fine. And this is it's in Spanish. So
okay, so
we
should
can
I
move to the next one.
Forward?
Yeah, we can move to the next one. So they actually finished the study, the one who started in December and ended in January, and they published the study. The study is with more than 200,000 people, which is a lot of people. They started like taking control of people the people who receive ivermectin and the people who don't receive ivermectin, and they check if these people end in the hospital. It's a huge study. It's 200 and
It's a huge study, correct?
yeah.
When did the study come out?
In May, I think the second week of May.
Did WHO not see this study yet?
No. No. So this is the result of the study. The result of the study in average is like they have a reduction of 68% in hospitalizations from people not taking the medicine and people taking the medicine.
Sorry, please, my apologies. I was going to read this table, so please go ahead.
No, the treatment is basically ivermectin, aspirin, and paracetamol. That's it.
So 77,000 people in the intervention, that is ivermectin, and 154,000 people in control. So almost 2-to-1 ratio,
yep.
And a huge number.
It's a huge
and if we look at the p-value, so let's see, hospitalization 30 and younger, that is generally a lower area, but still comparing the two, here we are saying 0.14% and here is 0.63%. So almost 3x.
The reduction is 78% in hospitalizations.
Yeah, and 0.22 is the p-value. So if I go here for, let's say,
0.22 is the reduction in is the reduction in hospitalizations.
Oh, I see. So that is
the risk ratio.
This is the
the range.
Range
with 99% of
so this is the
significance.
Got it.
95.
And 60 to 70 years of age, ivermectin group 0.87% versus control group 1.97%, 0.44 risk reduction percent, and confidence interval, the range is 0.32 to 0.6. These are beautiful results.
It's a huge amount of people.
Yeah.
And you can't explain the results with any other. Yeah, there is no explanation. You can control by age. You can control by. They have in the next you can see by comorbidities. You can control by the severity of the disease. And in every group is the same. There's a huge reduction. Is significant and.
Yeah, I love it. Thank you very much for showing these results.
Yes, this is by the groups. Like people with mild symptoms, the reduction was 62%. People with moderate symptoms, the reduction was 69%. People with severe symptoms, the reduction was 73%.
That's huge.
It's a huge, and it's a huge amount of people.
Yeah, so this is very important because one of the criticism of the ivermectin studies from these leaderships is that here these are weaker studies, there are less number of people, the designs are poor, and so on. So here is a huge data set to look at.
Yeah, they publish the data set, so anyone can go and look at the data. They have the numbers for every person in the study, so you can compare. Anyone can do it. Anyone can do it. It's
excellent.
It's just, and there is something else in this study that some people in Mexico were saying, this is, you can't compare because there were some people when some group was in November and the other group was in December. They have in the data, you can compare week by week, the group of people, the same week, and it's the same result. So
interesting. Yeah. So thank you very much, Juan. Thank you for presenting the data. Is this data available on FLCCC site as well?
No,
not yet.
Not yet.
Okay, perfect. So we are the first ones to see this on Cool Beans. So thank you very much. And Juan, thank you very much for joining us. Thank you for presenting this as well. I know it is East Coast, so this is late on your side. I can actually see some redness in your eyes. So thank you very much for doing this. For the Cool Beans, what I'll do is this: we would hang up here, and then we would do a little chit chat before the long weekend. I want to discuss a specific topic instead of just a chit chat, and I want to discuss the shedding by the vaccinated folks. So this common myth or rumor or problem, I want to discuss that as a topic, and then we can have a chit chat if we like to. So Juan, thank you once again from all of us, Cool Beans, from me, and
thank you for having me.
Thank you for your work
and the opportunity to share this information.
Thank you.